All right. All right. Good morning, everyone. We'll go ahead and thank you all for being here online, but we'll go ahead and call it to order. Good morning to all the members of the MAG Human Services and Community Initiative Committee. As a reminder, please turn your mics on and clearly state your names before speaking to ensure the members of the audience can hear you, and please mute your mics when not speaking to eliminate feedback. A voice vote or roll call vote will be taken for each action item on the agenda. Phone-only attendees will need to press *6 to unmute themselves. We will begin the meeting with a roll call of all members.
Thank you, Mr. Chairman and members of the committee. When I call your name, please unmute and state your name, or just state that you're here, please. Councilmember Wally Campbell.
Here.
Councilmember Allie Klein. Councilmember Monica Dorsey.
I'm here.
Thank you. Councilmember Jen Duff.
Here.
Thank you. Councilmember Christine Ellis. Councilmember Barry Graham. Councilmember Graham. Councilmember Janine Guy. Councilmember Bill Patina. Vice Mayor Kathy Tilke.
Here.
Thank you. Councilmember Tina Conde.
Here, but I'm not quite sure why it's our council assistant's name on here. I don't know how to change that.
That's okay. Thank you. We recognize your face.
Thank you.
And Chair Navarro.
And I'm here.
Thank you very much. Mr. Chairman, we have quorum.
Okay, thank you. Call to the audience. MAG provides the opportunity for members of the public to submit written comments via MAG website. Comments received 2 hours prior to the meeting will be shared with committee members in advance of the meeting. An opportunity for public comments on the agenda was provided ahead of the meeting. Amy, do we have any public comments?
Mr. Chairman, no, we do not.
Okay. We're going to go ahead and go to approval of November 9th, 2023 minutes. Are there any questions before we request a motion to approve the minutes?
Yes, Mr. Chairman. This
Well,
is Wally. I did not get an agenda for today's meeting, and I don't know if I missed it in the email, but could one of your staff please email it to me now so that I could print it out?
Councilmember Campbell, we apologize for you not receiving the agenda. We'll go ahead and send that out to you right now. If you don't receive it, please do let us know.
Thank you very much.
You're very welcome. Sorry for the inconvenience.
That's okay.
Okay, any other questions or concerns? I'm hearing none at this point. So I'll go ahead and call a motion for approval.
This is Councilmember Condi. I move to approve the minutes from November 9th, 2023 meeting.
Here we have a motion for approval. Do you have a second?
Councilmember Ellis, second.
And we have a second. All in favor, say aye.
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 All opposed, nay. Hearing none, it approves.
Sorry, just for state law, we have to have
Oh,
a
that's right.
visual of folks. And there are a few people who didn't quite have their camera on. So if we could please do a roll call of the individuals without their cameras on. Councilmember Graham, how do you vote?
Who did you call? I'm sorry.
Sorry, I was calling on Councilmember Graham.
Oh, Graham. Okay, thank you.
Councilmember Guy, how do you vote? Councilmember Graham, we can see you now. Are you able to unmute? You can give a thumbs up.
Oh, can you hear? Yeah, it wouldn't let me chat. It wouldn't let me, turn on my camera or anything. But it seems to be working now. Yes, sorry about that. Thank you.
Oh, no worries. Thank you.
Yeah, and I couldn't when roll was called, right?
Yes.
Yeah, I couldn't. I'm present.
It's not a problem. We all struggle with the technology issues every once in a while. We will note your attendance from the beginning of the meeting.
Thank you. I'm sorry about that. I just couldn't get my. So, thank you.
It's okay. Not a problem. Trying again for Councilmember Guy. How do you vote? And Councilmember Klein, how do you vote?
Yay.
Thank you very much. Mr. Chairman, the motion passes.
Okay, thank you.
Thank you.
Go on to item number 4. And this is the 2025 Social Services Block Grant Funding Allocation Recommendations. The MAG Human Services Technology Committee develops annual allocations recommendations for the Social Service Block Grants, SSBG, on behalf of the Arizona Department of Economic Security. The recommendations are based upon prioritization of human services related needs in the area of adults, families, and children, developmental disabilities, older adults, and people with disabilities. Amy St. Peter, Deputy Executive Director with MAG, will present the fiscal year 2025 SSBG recommendations for HSCIC action and discussion regarding changes from last year.
Thank you very much, Mr. Chairman and members of the committee. I would like to thank you for your continuing advisement and direction on the development of these allocation recommendations for the Department of Economic Security. Tyler, next slide, please. So just as a quick review, many of you have been on the committee for a long time, others are newer. We have been developing these recommendations for DES for decades. This was actually one of the first responsibilities of this committee when it was formed back in the 1970s. And so the Social Services Block Grant is really flexible. It's a great funding source because it can be used for a variety of different purposes. The allocations that this committee develops goes to DES as the intended funding plan. They are able to make modifications throughout the year as needed, which makes it even more flexible. So this is a really important funding source that is also a very steady funding source for folks. And so a lot of nonprofits and other agencies are able to utilize this funding to really help people who are in need. Next slide, please. The level of funding then remained constant from last fiscal year to this fiscal year and in the amount of $3.68 million. Next slide, please. And as the chair stated, this funds in a few different areas that are really important: Department of Child Safety, Division of Aging and Adult Services, also for the Rehabilitation Services Administration. This funds a variety of different services. Over the years, the allocations have changed in response to the emerging needs that we see out in the community. DS really appreciates the recommendations of this committee because they see you as having the pulse on the needs in your individual communities. So thank you very much for helping us to develop these regional recommendations based on your individual priorities. Next slide, please. We are working very closely with DES. We actually just spoke with DES again within the last week or so, just to make sure that we're meeting a need. They do appreciate the fact that we continue to develop these allocations and have done so for years. Next slide, please. This is the feedback that we had received. There are some questions about some of the funding that had been provided or that had been allocated in these areas. Just wanting to clarify, adaptive aids and devices and rehabilitation instructional services, those are important to allocate, but they're only used upon requests. And so one of the questions when we're speaking with HSTC, I'm chair and vice chair, and thank you to Melanie Dykster for being part of this meeting today. Those funds weren't requested. So DES had the flexibility to move those into different line item areas. We are not at this point recommending allocations in those 2 line items, but if DES needs funding in those line items, they can pull that funding from other line items as recommended by this committee. So we just wanted to bring you up to speed on that. All of the other funding that's been allocated has either been used or is on track to be used within the appropriate time period. Next slide, please. So this is what I was just referencing with DCS. They went through their allocation pretty quickly. Those funds are very much in need. RSA is on track, as is the Division of Aging and Adult Services, to spend down that full allocation. The funds are not being wasted or left over. Next slide, please. These are the recommendations then for DCS, Department of Child Safety and Division of Aging and Adult Services. The allocation recommendation remains the same from last fiscal year to this fiscal year. Those funds are being used, are being put to good use. As discussed in the Rehabilitation Services Administration, funding was shifted in order to target the areas of greatest need. Next slide, please. I would very much like to thank the HSTC work group that consisted of the chair of HSTC, Susan Hallett, and Mary Lynn Kastanek from the Aging from the AAA for the Region 1. Next slide, please. That concludes our presentation. Melanie, do you have any additional comments that you'd like to provide based on input received from HSTC?
Not unless anyone has any specific questions I can answer at that time.
Great. Thank you very much, Melanie. Mr. Chairman, that concludes our presentation. We're happy to answer any questions that you might have. This item is for action for a recommendation for approval.
Got it. Thank you, Amy, for that. Do we have any questions from the committee? Okay, I am seeing none right now. We will go ahead and then get ready for a motion. And after hearing no questions, do we have a motion for approval?
I'll move to approve. Monica Dorsey.
Monica Dorsey, we have a motion and a second.
I second.
Kelly
This is
Klein.
Wally.
Oh, Wally is beating me in here. That's okay. Either one of us.
Hi, Ally.
Hi, Wally.
Got a second. Okay, everyone's cameras on, and we're going to go ahead and go through and take a voice vote. Amy?
All in favor, please respond by saying aye.
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 Any abstaining? Okay. Councilmember Guy, your camera wasn't on during the vote. How do you vote? You want to give a thumbs
Aye.
up? There you go. Thank you. very much.
Okay.
Councilmember Ellis, how do you vote? I think I heard an aye.
Yes, aye.
Excellent. Thank you. Did I miss anyone? Okay, Mr. Chairman, the motion passes.
Okay, thank you so much. We'll go to the next item, item number 5, community cares with Contexture. In the partnership of Arizona Health Cost Continuance System 211, Arizona and Solary Crisis and Human Services, Contexture implemented a single statewide referendum system, Community Cares, to address social determinants of health needs. And in Arizona, Kelly McGain, tongue-tied,
It's a mouthful.
social determinants of health directors will provide an overview of the referral systems and discuss ways members of the committee and participants in the work. Kelly, the floor is yours.
So much. Thank you for having me again. My name is Kelly McGann. I am the Director of Social Determinants of Health at Contexture. So I oversee the Community Cares program in Arizona, as well as our SDOH programming in Colorado. And I agree, my title is a mouthful. Next slide, please. And again, so today I'm going to provide an overview of the Community Cares program. I will then jump into the goals and the benefits of participating, some of the standards and expectations of being a participant within the program, and then how Community Cares supports addressing social determinants of health across Arizona. Next slide, please. So before I even jump into the program history and genesis, I just wanted to level set and align on, when we're talking about Community Cares, what do I mean? So Community Cares is Arizona's statewide closed loop referral system. So it supports streamlining the sending and receiving of referrals across sectors. Between, healthcare providers, community-based organizations, government entities, and really enhances the sharing of social determinants of health data, again, across those different provider types. Community Cares, we utilize a software solution called Unite Us. And so, when you hear Contexture, Unite Us out in the community, we are all part of the Community Cares team. It is a true partnership, and I'll speak to some of the other partners here in just a minute. Next slide, please. So again, as I mentioned, it's a partnership among all of these different agencies to really enable the exchange of social determinants of health data between our healthcare entities as well as community organizations, government entities. We have some education schools involved, churches, and so Contexture oversees the Community Cares program. And we partner with Access, Unitas, and Solari to provide the Community Cares program across Arizona. Next slide, please. Community Cares came from and is part of Access's Whole Person Care Initiative. So Access is our funding partner, and they provide oversight and direction of the program. The Whole Person Care Initiative began back in 2019 with the focus of really identifying, the role that social risk factors play in influencing health outcomes. And the goal was really to provide an intervention to address those social risk factors for Arizonans. Next slide, please. As I mentioned earlier, Unitas is a partner in this work. And so again, you will see Contexture team members, you'll see Unitas team members. We are all out in the community, working with agencies, providing outreach, doing, in-person training, virtual training, individualized support, and we are all part of the Community Cares team. Unitas is the software solution that powers the Community Cares program and allows for the streamlined sending and receiving of referrals. Next slide, please. As I mentioned, Contexture, the organization that I am with, oversees the program. And our goal is really to provide support to better coordinate care through the sharing of data across, again, across sectors and among providers. And our goal really is driven by the fact that, we know that providers can provide better care when they have that full view of a patient's history and access to, their all of their information, whether that is their health related information, of course, as well as adding in their social determinants of health data. Next slide, please. All right, so we can go ahead and dive into the goals and the benefits of the Community Cares program. Next slide. So as I mentioned, the goal is really to connect sectors, connect Arizona communities, and really streamline the sharing of information between different provider types to better provide services and an intervention focus on the social risk factors of Arizonans. Of course, with the goal of improving health outcomes. We utilize a data-driven approach, and this is in a variety of ways. We, of course, utilize data to inform the program direction, but then throughout the system, all of the organizations who participate within Community Cares also have access to data. So they have access to raw level data for their organization. But then they have access to a Tableau dashboard, which provides a statewide view of social determinants of health across Arizona. But then organizations can take that and kind of zoom into their community level data to help inform community health efforts. And then, sorry, one more goal. In partnership with Access, we support the SDOH DAP program and support providers in meeting their SDOH DAP milestones. DAP is an acronym for the Differential Adjusted Payment Program, which I will speak to in a couple of slides. Next slide, thank you. So some of the benefits of participating in the program, as I've already mentioned, our goal is really to connect healthcare and community providers across sectors to really streamline the sending and receiving of referrals and enhance the sharing of SDOH data for Arizonans. By participating in the program and utilizing the Community Cares platform, a provider who sends a referral will then receive confirmation and updates regarding the outcome of the referral for their clients or patients. I mentioned earlier that Solari is a big partner within the Community Cares program. And so by participating in the program, you will have access to the full Solari 211 resource directory that is fully ingested within the platform. And so folks can search for in-network referral to send referrals for, or you can research the full resource directory across Arizona. And then I also already mentioned the data component, right? So one of our goals is utilizing a data-driven approach. And so we utilize data to help inform our outreach efforts, understanding what are the top requested needs across the state, and even diving into what are the top requested needs that are the referrals are typically rejected, and how can we do a better job of outreaching to those organizations, and certainly prioritizing those service types. I also mentioned that organizations have access to data through the Tableau dashboard or through the raw data exports that they can pull from the platform. And so organizations have access to analytics, and then also the outcome measures to determine, they can look at, is their program effective, and how can they better provide services? And then we provide a individual onboarding for each organization so that we can make sure that the platform really meets the needs of your organization and can fit into your workflow. Next slide, please. So I'm going to jump into some of the incentives that are offered by participating in the program. We know that there's a lift to our community-based organizations in providing these services, and also to implement a new system. And so through partnership with Access, as well as Vitalist Foundation and the Garcia Family Foundation, we are able to offer 2 different CBO programs. We offer the CBO Incentive Program and then the CBO Assistance Reimbursement Program. The CBO Incentive Program incentivizes CBO partners to participate in the program by receiving referrals to provide social care services, right? So that could be, food, housing, any of those social determinants of health domain type services. And then there are certain milestones and utilization metrics that these CBO partners agree to meet by participating in the incentive program. And then they can receive up to actually $12,000 now. So this slide is a little bit outdated. As of January 1st, we are now able to offer $12,000 in incentives for 5 different milestones. So I will get you all updated information for the incentive program. I also mentioned the assistance reimbursement program. So again, we know that there are sometimes technology barriers and needs to implement, or different barriers to implement a technology solution. So we offer up to $5,000 to support technology needs or staff training. So organizations can request reimbursement for purchases. Some typical things that we see are support with internet, purchasing computers, right? It is a web-based platform. And so you do need to have access to a tablet or a computer to participate. And then also of the $5,000, $1,000 can go towards training, time for your staff to train to learn how to implement and utilize the Community Cares platform. Next slide, please. All right, so I had mentioned the DAP program earlier. So that again is the Differential Adjusted Payment Program. This is a program that is offered through Access and Contexture supports. And there are different components. There is the HIE DAP component. There's the Arizona Healthcare Directives Registry DAP program. But for Community Cares, we support the Social Determinants of Health DAP program. And this incentivizes providers to screen for social care needs for their patients and then utilize Community Cares to send referrals to connect and provide that intervention for their patients. And it provides an incentive. So they receive an adjusted reimbursement amount based off of participating within the DAP program. And our team supports providers in, again, learning how to utilize and implement the platform, but then also we provide post-live support. So really we'll sit down and understand, okay, what is your workflow and how can we better support your team in adopting and utilizing the platform and understanding, you know, how we can best fit this into your current workflow. Next slide, please. So I just wanted to provide a quick overview of what types of organizations can participate within Community Cares. You know, we typically say everyone can participate, but I really wanted to put down, you know, all of the different types of providers that we currently have participating. So we have, like I mentioned, healthcare providers. We also have health plans, ACOs, we have integrated care networks, public health and other state and local government agencies. We have schools participating, churches, and other CBO type organizations. And then the Community Cares program, as I mentioned earlier, is funded fully by Access. And it is free for participants to utilize. And that is not just for Access providers. This is across the state. Access is funding this, again, to connect sectors. So it is free for all of these different types of organizations to utilize the platform. Of course, we have a scope of work. And so within that scope, organizations can utilize the web-based platform, again, to send and receive those closed loop referrals, to access that full 211 resource directory. They can utilize assessments and other social determinants of health screeners directly within the platform, and the data components that I mentioned earlier. Of course, there are features that Unitas offers that are outside of the scope of this program. And so I do just want to mention that here. But all of those different features that I mentioned come free of charge. So some things that that could be a charge is if an organization wanted to utilize an integration with their electronic health record, there is a cost associated with that. And then there, you know, are additional add-on features. Next slide, please. All right, so now we can kind of dive into what are the standards and expectations, right? So if you agree to participate in the program, what are we asking you to do to maintain, you know, our network standards? Next slide, please. So by participating within Community Cares, you will know that we ask and set the standard that organizations should respond to referrals within 2 business days. So if you send a referral for your patient, you should expect a response within 2 business days. But there is also the opportunity to recall that that referral if for some reason an organization does not respond within that time frame. And then we monitor referrals and how long they are outstanding, so that we can check in with organizations to understand, you know, can we better help train you, or maybe, you know, maybe they're at capacity and they need to turn off the ability to receive referrals. We ask organizations to reach out to their clients and patients at least 3 times over 10 business days before closing out a case or a referral. And then we also ask organizations to update their program information and their organization information within the platform at least once a quarter, and also, as changes happen. So if your business hours change, we would want that to be reflected within the platform so that, folks who are sending referrals to you have the most updated eligibility information as well as organization and program information. You also have the ability to add and remove users within your organization directly within the platform. And so, we ask that as folks move on to different positions or out of your organization, that you would update and remove their access to the platform within 2 business days. And then there also are some expectations around client cases. And so, we want to know within 2 business days, was that patient able to receive the services that they needed, or was that an unresolved case? All right. And then we, of course, ask for confidentiality and privacy consistently. So jumping into how the program addresses social determinants of health across Arizona. Next slide, please. Again, we've talked over all of these mostly. The goal is really to provide that whole person care approach and to really utilize the statewide social care data to identify gaps in resources, help communities inform their health efforts, and better support vulnerable populations with the goal of improving health and well-being for Arizonans. Next slide, please. So I wanted to provide you just some information and data on what we're seeing in the network. And so I actually pulled updated information right before this meeting. So as of today, there are 2,134 organizations live on Community Cares, and that is only across Arizona. And there are 960 programs available from those organizations. I mentioned earlier, we have the resource directory ingested, and so that's where you'll see the 3,500 plus resources available on the system. And then again, as of this morning, our partner organizations have sent over 10,000 referrals utilizing Community Cares. So Community Cares is a little over a year old, and so we're just really proud of the work that we have accomplished in partnership with Access and all of the other partners I've mentioned. We certainly have a ways to go, but just want to highlight some of our wins here for you today. Next slide, please. So this is some of the data we're seeing within the network. So you can see that really since January of last year, we have trended upwards in our onboarding numbers. As of December, we were able to onboard an additional 30 partners. And so we are seeing right now that we onboard anywhere between like 20 and 40 organizations per month onto the platform. Again, that is individualized support. So a lot of connecting, understanding your workflows, and again, understanding how the system can work best for you. What I want to point out on this graph here is on the left-hand side in purple, that is our community-based organizations onboarding numbers. And you can see that has trended upwards. And so we have really been prioritizing outreach and connection to our community-based organizations and are excited to see that upward trend in the data. Next slide, please. So as we've seen the growth in organizations onboarding month over month, we've also seen an increase in referrals month over month. Next slide, please. All right, and then I think this is the last graph that I included. I just wanted to give you guys a snapshot of the service types that we're seeing requested within the platform. So here we're looking at the number of referrals by service type. On the left-hand side, you can see that the domain of the referrals that are being requested. I'm sure it's not surprising to you all to see that housing and shelter and food assistance are consistently our top requested resources. And then you can see on the right-hand side, the key that outlines the status of those referrals. And so I think also probably not surprisingly, if you're looking at housing and shelter, that purple shows, that there are actually a good amount of decline referrals for housing. It's, of course, a really tough need to fill. And we're excited that we are starting to engage with some of the housing partners across the state to hopefully, improve the numbers that we're seeing here. Next slide, please. All right, I think that is all. We would love to invite you to an upcoming information session where you can, again, learn a little bit more about the platform and then see a demo of the Community Cares platform and just really see what it looks like and all of the functionality. If you're interested, we'd love to support you joining the Community Cares Network, and then to ensure that the platform can be effective and beneficial for you as an organization. We will also, prioritize outreaching to your partners to start onboarding them as well. So I've included our email address for the program. It's communitycares@contexture.org. And then I'm happy to share my email as well. It is kelly.mcgann@contexture.org. I will share out an updated flyer for you all on the CBO program, since we have increased the number of incentives and dollar amount for the incentive program. And that is it. I'm happy to answer any questions if we have time for questions.
I have a question, Madam
Yes.
Chair, or Mr. Chairman.
Yes, go ahead.
This is Councilmember Dorsey from El Mirage. Kelly, can you give us some idea of what the potential universe is for organizations that you would want to eventually have signed up for this? Or what that number is, but also kind of what you would consider to be at scale. It would be producing, sufficient data to really have a meaningful usefulness.
Yeah, that's a tough one. So I mentioned right now we are provider types. We have, our MCO and ACO partners onboarded. We have healthcare providers, and we're really focusing on CBO partners. That's been a little bit of a challenge just because it is, more of a lift. I don't know if I could give a solid number on number of organizations. I would say what I'm expecting, and one of our KPIs regarding the number of referrals is we're shooting for 8,000 referrals per month this upcoming year. And right now I think we're seeing around 5,000 per month. It's growing, of course. Where we are going for outreach next is we're starting to really engage with our government entities. So we're meeting with DES, I believe in 2 weeks, to understand how we can onboard, all of the different DES programs. So I would say government agencies, and then we're also working with Access to Engage, jails, and justice involved organizations. So I don't have a good answer for number of orgs, but I hope I gave you a little bit of direction in where we're going.
Okay, and then just one quick more question. When it talks about healthcare, that includes mental health services, right?
Correct. Yes.
Okay.
And there
All
are, I didn't dive into this, but there are, of course, sensitive service types that are, flagged and protected within the platform. So of course, that information is not available across the network. So behavioral health, domestic violence, those are some of our sensitive service types, which have additional protections.
But the data that's gathered is available to somebody. I mean, it's some.
Right, yeah. So it will be available between the sending and the receiving org, but not among the entire care team.
Yeah, okay.
Mm-hmm.
All right. Thank you.
Yes, of course.
Any other questions? Real quick, Kelly.
Mr. Chair, this is Councilmember Ellis.
Councilmember Ellis, go ahead.
If I may, of course, this was an amazing presentation. I'm really grateful that your team is so thoughtful and to putting things into context like that. But for me, in my mindset, is like whenever we're dealing with social services and helping people, those who are in need, I always quantify that the less amount of people that we serve, the better that the situation is. So I don't know if you could speak into that a little bit, because I know that your numbers, you want to grow from 5 to 8,000, but shouldn't that be also the reversal of those numbers, letting me know that you are very effective, or those organizations that you are working with are very effective in providing the help that's needed, so that you are not bombarded with so many of those referrals?
Yeah. I really appreciate you bringing that up. Of course, that is the goal, right? To work ourselves out of a job, so to speak. I think the 8,000 number is me really trying to quantify the growth of organizations and onboarding and where we're going. So I expect to see 8,000 referrals per month by growing the number of providers. But certainly, that is the goal, to better connect and coordinate care so there are less needs. I realistically think that, that will take quite a bit of time, but I really appreciate you bringing up that comment.
Okay, thank you.
Thank you, Councilmember Ellis. Great question. Anyone else? Kelly, I just, first of all, I want to say thank you. I guess my question would be, for us, is this what's the ask for us for us to contact our social services within our communities? I know when I think about this, and what you're saying is, I'm looking on me being the fire department, on the fire side, our Care 7, our CR teams in Phoenix, them having access to this information. Do they already have that, or have you already touched those communities throughout all the cities? I know that every city has a potential program on the 911 side when they do touch a person that they can be plugged in. Is that already in effect, or do we need to reach out to those entities so that they know that this service is out there?
It is not currently in effect. I think we have a few, fire departments. I know Surprise Fire Department is engaged, but certainly just this opportunity to share about the program I really appreciate that, and would love for you to, as you feel comfortable and appropriate, to spread the word and share information. It's a free program, and certainly I think it is beneficial, and maybe I'm biased, but if you all think it is beneficial for your organization, I would love to support onboarding you all onto the program. If there are other opportunities for me or my team to come and share information, provide a demo, we really just are hoping to do outreach. So I would say whatever you think is appropriate, please tap into me. I'm a resource and would love to just continue to spread the word about community cares.
Yeah, and thank you, Kelly. I kind of see it the same way. I think it's an opportunity for each of us individually to share your contact information. And if you guys wrote it down, great. If you didn't, hopefully we can get that contact information. And I think the plus would be to, share this with our community outreach peoples in our individual cities, our 911 people, PD fire, our connectors, whatever those connectors are within the cities to, excuse me, to look at this information. I think there's a lot of information here on how it works and how you connect. I think to Councilmember Ellis's point is, I know the thing is we always want to improve our services and our connectivity so that the individuals are not relying on 911 all the time, and they're being more productive and they're being taken care of. So I think it's a potential opportunity for those strides. I like the connectivity, if I'm correct, with HIE, the Health Information Exchange, or other entities to where information can be glued together, if you will, so that when an individual is caught, all that information about that person can be generated up so that more precise and better help can be carried on. I also enjoy the fact of your data collection to be shared with, let's just say, our city sources, so that they have that information, because I think that as we go down the road, when we have issues that come up as council members, that we can show that we're providing or we're having these entities there on our fingertips and showing, the data to our residents that, programs like these are helping us. What can we do to improve? And you guys are trying to improve on that stuff. And then the consistency, to Councilmember Ellis's point, the consistency of effective services, that knowing that the individuals are getting taken care of, are being in a way so that they're providing care for themselves, so they're not relying on others, and or they have a resource of people to help them and not just rely on 911, if that helps.
Right. Yeah, no, I appreciate that overview. I think one thing I would add also is I really, would love for it coming from me is different than coming from you all as trusted folks within your communities. And so really that is why I say, like, if you feel that this is beneficial and can share the information, that will go a lot further than me just saying, I think this program is really great. So I just, again, appreciate the opportunity and would love to continue to share information with you all if you have more questions or would like to see a demo. Thank you again.
All right, thank you. Any other questions?
One last question, Chair Navarro.
Go ahead.
Kelly, are you going to be getting that information out to us for the virtual, the Community Information Center session?
Yes, I don't have access to the chat right now. So I think Mimi, I've been connected with you. Maybe I can share some resources for you to share out with the group. Does that work?
Yes, that works. Thank you,
Okay.
Kelly.
Perfect. Thank you.
All right, perfect.
Thank you.
Thank you so much.
Thank you, Kelly. We appreciate your time. Thank you so much. All right, we're going to go ahead and move on to item number 6, affordable housing data update. The MAG region is one of the fastest growing regions in the nation, and with growth has come the recent rise in home prices. Housing market, as well as larger economies in the regions, have shift over the few past years. Scott Wilkins, Data Advisory Program Manager with MAG, will present on this item. Before Scott begins his presentation, Amy, would you like to say a few words about affordable housing and the housing grants?
Yes, thank you very much, Mr. Chairman and members of the committee. We are very excited to announce that really on the basis of the data that you'll see in just a moment, as well as input from you as our member agencies and other community partners, we applied for and have since received a $500,000 grant from the JP Morgan Chase Foundation. This funding will be used to provide free and customized technical assistance to our local and tribal governments in the region in order to help them to build and preserve more affordable housing. So we're very excited about this. We've recently met with the chairs of our Human Services Technical Committee, as well as the chair and vice chair of this committee, and really looking forward to working with both committees then to identify what are the technical assistance needs or interests that you have as local and tribal governments. And then we'll take that information, we'll compile an inventory, and then we will secure really qualified expert consultants in those very specific areas. Then we'll ask you what you'd like to work on first. You can receive that customized technical assistance one-on-one. So one local or tribal government with one consultant, or if there's a few of you who share common interests, we can have small groups working together. And if there's a topic that's of very broad interest, and we can offer training that would be open to others, such as the webinar that we'll be offering next Thursday, a week from today on January 18th. That is at 11:30. It's a free webinar. We hope that you've heard about that. We hope that you'll sign up and help us to promote that. We're featuring experts from throughout the area who can speak to what are the tools, what are the very specific tools and tips that can be used to build and preserve affordable housing. So we'll be able to offer support in an array of different options there. And then finally, we'll compile all of the lessons learned, the tools developed, the tools shared into a final report and training that would be open to the whole region, the whole state, and we're hoping to offer that nationally as well. The grant is for 2 years. Again, $500,000. The vast majority of that funding will be used very specifically for the consultants. We want to funnel as much of the funding as possible to the consultants so they can provide you as much assistance as possible. So we're going to the Human Services Technical Committee next month, and we'll be working with them. We're currently working on compiling that inventory. We'll bring that inventory to you then in March and hope to have any further refinement that you might like to offer. And if you'd like to meet with us one-on-one in that interim to share your thoughts about what kinds of assistance your community would like to receive, please do let me know. We're happy to meet with you sooner rather than later. But if you have any input on that grant, any questions, anything like that, please don't hesitate to reach out to me. Love to work very closely with you on this. And thank you for the opportunity to mention that. Before I turn it over to Scott, are there any quick questions about the grant opportunity? Okay, more to come. Scott, the floor is yours.
Thank you, Amy, and thank you, Mr. Chair and members of the committee. Again, my name is Scott Wilkin. I'm with the Regional Analytics Division here at MAG. Before I pull up my presentation, just a little bit of background about our division. We gather data, we do analysis, we provide a lot of information to our other divisions, primarily transportation and air quality, to help with the modeling that they do. But as a result of all the information that we have to get for them, we have a ton of information on housing, on workforce, on education, on you name it. We have all kinds of stuff. And so we've been doing other kinds of reports that we put stuff online for people to get information. And then a few years ago, we started looking into the housing market. The housing market was going crazy, and we wanted to know what's going on and what kind of trends can we see, what can we track. And lately, we've been doing a lot of presentations showing what we found, and we've added a few slides about the overall economy. And so that's what I'm here to show you today. If I can remember how to share my screen. There it is. Let's share that. And okay, so you should be seeing the slideshow now. Is that correct?
Scott, it's not in slideshow presentation mode quite yet.
Let's change my share then. Apologies.
It's okay.
There, that one. Is that better? Yes?
Yes, that's correct, Scott. It looks good. Thank you.
Okay, thank you. As you know, Maricopa County is growing fast. It saw the largest population growth of any county in the nation. 56,000 people from 21 to 22, far greater than Harris County, Collin County, all those in Texas, places in Florida. We're growing very fast. Our unemployment rate in the Phoenix metro area, and most of these slides are going to be about the metro area. When it says Phoenix MSA, that's Maricopa County and Pinal County. And some of them are going to be about Maricopa County only, but I think most of them are for the MSA. So that our unemployment rate is slightly higher than that of the US, but it's largely tracked with the national unemployment rate, and has been lower and has been higher. Right now it's slightly higher. And I lost it. Sorry about this. I'm not sure. There's unemployment. And our cost of living index has been rising. We are currently ranked 12th among the top 25 most populous metros in terms of cost of living. So the national average, they peg at 100. If you were lower than 100, then you have a lower cost of living than the nation as an average. And if it is higher than 100, then you have a higher cost of living. So we are right there at 103.8. And so we're a little bit higher than the average. It doesn't, on my screen, it doesn't look like it's showing the top 3: New York, San Francisco, and LA. And then you can see some of the other places that you usually expect to see with higher cost of living. But we are growing in that way. We're 12th right now. We were 18th a year ago. The economy as a whole is diversifying. We looked at the employment by industry. 10-15 years ago, we were heavily reliant on construction, especially residential construction. That's one of the reasons we got in so much trouble when the recession hit, that if we weren't able to build houses, we didn't have as much of our economy didn't have much of the normal engine revving it. So over the past 10-15 years, the region has really diversified, and we've got a lot of jobs in transportation and warehousing, especially. Construction is still a very important component of our economy. You can look out your window probably wherever you are and see evidence of that. But we've also got science and manufacturing, healthcare, all kinds of things have grown substantially, especially over the last 6 years. Now, when we get into housing, one of the things we've been tracking for a long time are residential completions. When a housing unit is finished, gets a certificate of occupancy from the jurisdiction, the city or town, and we've been collecting those for about 30 some years. And we've been able to track how many completions, how many units have been completed. And we're looking right now at the high of 47,000 in 2005. And now we're starting to get close to where we were before the recession, not quite up to those crazy numbers, but higher than we were anytime since 2008. At the same time, you can see the dark blue line is single family and the light blue line is multifamily. When we stack those together, you can see back 18 years ago now, the light blue line was pretty small compared to the dark blue line, and that represents mostly single family being built. But over the last 6-7 years, the share of multifamily has increased substantially, and so we're seeing a lot of apartments, a lot more units coming online at the time as things are getting built. Again, we're getting back to total units built close to the pre-recession levels, and a lot more of that is multifamily than it used to be. I'm sorry, I'm having some technical difficulties here. It's skipping some of my slides. But now we're going to look at the median sales price, which has stayed fairly steady since June. So we've been tracking this. These are actual sales that we get from the MLS. We've got a really great partnership with them. The gray line is the 21 to 22, and then the blue line is 22 to 23. So you can see we had a high in June of 22 of 475,000, which is a ridiculously high median sales price for this area. But then it started dropping, and then since then it's remained pretty steady. Probably higher than it should be, but it is not having those wild increases like it was a few years ago. And we look at a map of median sales price. We've got a lot of geographers on our staff, and so we look at a lot of things spatially. And you can see that where the median sales price has changed. We have 42 zip codes with a decrease of more than 10%, 10% or more, and that's in that orange, that dark orange. And so you can see where that is kind of spaced around the valley. Part of that is places that you traditionally see lower home prices, and some places where you saw some home prices that were ridiculously inflated more than other places, so they had no choice but to come down. So we've seen a kind of a combination there. We've also seen a few zip codes that have increased in the last year. When we look at total inventory, this was a big problem in 2021, especially about, I guess, 3 years ago now. It was below 10,000 units that were available for sale, and so that was driving up prices as well. You heard lots of stories about people who were selling their homes and were getting 5, 6, 7, 8 bids at the same time. Some homes that were getting sold before they even went on the market officially. It was driving up prices, but now we've got we saw a huge increase in inventory. It's lower than it was, but it's still higher than the below 10,000 number that we saw at the beginning of 2021. And so we're hoping that that number can start ticking back up as the warmer months start coming. Average days on the market is another thing. Like I just mentioned, homes that were sold before they were even put on the market. That decreased the average days on market quite a bit, but that has also rebounded and went up pretty high beginning of 2022, and has dropped about to somewhere around a normal level and has been steady for a few months since then. When we look at the available of apartment units, you can see this is where we get into the affordability. That the affordability has really not done well. You used to be able to find apartments under $500 a month back in 2010. These numbers are adjusted for inflation as well. So, but you can see that $500 a month apartment is an endangered species, or it actually went extinct 4 years ago. Now the endangered species is the 500 to 1,000. We've seen a huge increase in units that are above 1,500 a month, and are seeing a lot more above 2,000 as well. We were looking at, you saw the huge increase in the share of multifamily on an earlier slide. So we want to see if that's having any effect on the overall market. So the light green line is apartments that were built in the last, I guess, 5 years. We've got data through Q2 last year. This is when you're looking at the rent per square foot. You can see that that's substantially higher than all apartments. But you can see that big jump in late 2020, early 2021. The newer apartments were raising those rent per square foot numbers, but then the overall market followed and even had a bigger increase. And so we were trying to see if there was some kind of correlation there. If all these new higher end apartments are coming on board online, does that mean that the existing apartments are also raising their rents? And it kind of looks like that was the case. Multifamily vacancy was fairly low as of 2018. It dropped to very low when we were having this big housing crisis, and it's gone back up to over 10% vacancy rate, which is good. You need a lot of vacant apartments to have that turnover. 10% is probably about a normal level. We'd like to see somewhere around that neighborhood, and so that is a positive trend that we're seeing. Then we looked at number of vacant apartment units. Again, we see 22,000 vacant apartment units as of this data set, and then the size of the circle represents the number of vacant units in a complex. So you can see there's vacant units everywhere. But when we start looking at the rent, we can separate out rents that are greater than 2,000. So those red circles now represent units that charge more than $2,000 per month. And you can see that where those are located, and there's a lot of them in the Scottsdale and Tempe area, but we do have them all over the place. And so that's where, when we look at the vacant units, those are the ones that are least attainable by most people. And when we look at rents 1,500 or greater, that's where you can see it all over the place. And we have a lot more of those vacant units are on the higher end of the rent spectrum. And then we look at rent greater than $1,250, and you can see that there aren't very many places that have that rent that's below $1,250. There's 4,500 units with rent that is under the 25% of the median renter income. And so these are where the few more affordable units are. And $1,250 is affordable for a lot of people, but still not for everybody. And so we've still got a ways to go there. We've also been tracking short-term rentals, Airbnbs, and the like. That was another big problem, especially in Scottsdale and the East Valley. We saw a lot of housing units just taken out of the market, taken out of the housing market. So those were never even available. And so it was like, from a sales perspective, it was like they were just wiped off the map, and they couldn't even be considered as something that could be part of the inventory. That was going crazy in 2022, but those numbers seem to be going down, and we're going to be tracking that over time as well. Institutional buyers, places like Opendoor, Redfin, OfferPad, they were also buying up a lot of units, especially when they were cheaper in the early part of the teens. And then we saw a big explosion when interest rates were substantially lower than they are now. We've seen a lot of sell-off from that, and it seems to have gotten back down to about a normal level. But 2021, 2022, the institutional buyers were another part of the issue, part of the puzzle, causing housing prices to go so high. When we look at the Phoenix MSA and see that it's less affordable in the United States, we look at, this is the share of homes sold that are affordable at the median household income. So when you look at the median household income, you can see how many houses, or what percentage of houses were affordable to people at around that median household income. And we are currently, we were higher than the national average, but the last couple of years we are substantially lower and trending downward. We also talk about a stat called severely cost burden households. These are households that spend more than 50% of their income on housing. And so we've mapped that by zip code, where you can see the colors represent the number of households paying more than half of their income on housing. And we've highlighted some of the biggest zip codes with the biggest numbers. And note that 15% of households across the 2-county area are in that severely cost burdened category. 14% of households nationwide are severely cost burdened, so we're not out of sync with the nation. Still, either way, that is too many. And this that 15%, 14% stat takes into account all types of housing, but when you look at just multifamily renter households, 27% of those households are severely cost burdened, which is almost twice as many as the average. We've been tracking evictions for a while now, and you can see that during the pandemic they were very low with the moratorium in place, but now those have risen back to a lot higher than pre-pandemic levels even. And so we're tracking that, and that is also a big factor in the housing issues. When people get evicted because they can't afford the home they're in, there are fewer choices for them to go with a lot less affordable housing units available currently. When we look at permit activity, this is housing that we expect to be coming online in the near future. You can see back in 2004, we had that ridiculous high 65,000 permits pulled in a year. Most of those were single family, again, with that dark green line. This kind of tracks with the residential completions, the slide we saw earlier. Completions shows you what was built, and permits, if you look at the most recent numbers, show you what should be coming online. We've seen an increase in permits in the first half of 2023. We don't have full year data for 2023 yet, but we are seeing that is trending upward as well. So we're hopeful that the housing pipeline is getting filled up and is about to, I guess, to continue with this metaphor, spray a lot of housing units all over the place. I don't know how I got on that track, but that's what I ended up in. Speaking of the development pipeline, and I won't talk about housing as water anymore, but we have 275,000 housing units currently in the pipeline. These are active and platted. These are units in active and platted developments. So you as council members see these rezonings and these big developments that get approved. Not all of those start construction or have started construction just yet, but among the ones that have, or the ones that have been platted, we have 275,000 units in those developments. And in active projects, things that are actively under construction, 175,000 units have been approved in those. And so at 106,000 units in the active projects that are unbuilt, that's about 3 years worth of units at our normal pace. So we're seeing a lot of activity, and we're hopeful that a lot of the stuff is going to come online and help fill in some of those gaps. We don't know the price points of what those are going to be. As you know, when you're approving a development, you can't dictate what the sales price is going to be. That's going to be market driven, but hopefully with enough units, that's going to help bring prices down overall. In addition to those 3 years of units, we also have almost 100,000 units that are in projects that haven't even started yet, that you all have been approving. And so that is also encouraging that when that construction starts, we're going to have another probably about a year or a little bit less than a year's worth of units coming online. So when we look at the total pipeline as of 2021, we had 239,000 as of September last year, 275,000. Platted not started is also jumped by 50%, and then unbuilt units and active developments is down a little bit, but overall the numbers are still positive that we're getting a lot more units coming online soon. So some takeaways: we've seen robust economic growth in a diversifying economy. We've seen inflation is stabilized, but a little bit higher in some segments. And increase of cost of living might impact the region's attractiveness. Housing completions are back to 2007 level, which is a good thing compared to what it was in the teens. Increased residential permit activity and sales prices, vacancy rate are things that we're looking at that seem to be stabilizing. Vacancy rate is going up, which is good. And we've seen some affordability easing in some submarkets, which is troubling, but hopefully some units coming online there will help with that. Institutional buyers activity is lower, fewer short-term rentals, taking units out of the market is lower, and the 15% increase in improved residential pipeline is adding even more units. So the institutional buyers getting out of the market, Airbnbs being for sale for permanent residents, and then more units is increasing the supply overall. So the things we're hearing in the legislature the last couple of years from the home builders that there aren't enough housing units, we're seeing a lot of housing units coming into the market, new and existing homes. And hopefully that is going to be a big help to the issues we're having. That's what I have. I know that was a lot. We've got even more stuff. Some of the highlights from this presentation and these series of presentations is online. That URL on the screen there on the left. We've got a lot of information on maps.easymag.gov, data.easymag.gov. We've also got a quarterly newsletter where we highlight some of the new reports and data sets that we've put out. And you can get to all of that, all of this information that is available on our website whenever you need it, free of charge. And you can just go to those. Especially, I would recommend data.easymag.gov is probably the easiest one to find all this stuff. But you can get to lots of stuff there whenever you need it. That is my last slide. I am available for questions.
Thank you, Scott. Great presentation. Do we have questions? Council member, I can't read the name. Fine.
It's such a long name. Scott, thank you very much. I am a data geek. Just want to warn you in advance. So you'll probably be hearing from me. But one of the questions that came to my brain when you were including the 2023 numbers, were you including in your availability information residential homes for rent as well as apartments?
It's funny. As this meeting was started, I got a call from one of our member agencies, one of my friends at Surprise, who asked basically the same question: Do we have information on individual units? And it's hard because when we look at, I don't think I had a slide on the build to rent stuff, the Christopher Todd type stuff, bungalows or
Right.
whatever, everybody calls it something different. That's really easy to track because those are big developments and we've got a good data source for that. We don't have as good a data set for the individual homes that are for rent. So when we look at renter stuff, it's almost always multifamily stuff or single family complexes. We've tried to get some better information on individual homes for rent, but that's outside of the assessor code, which may or may not be comprehensive. It's not something that anybody really has a good handle on.
Okay, well, it's an issue. Rental prices in Surprise are an issue, and so and we have a very low vacancy rate at the moment.
Yeah.
Things could change tomorrow, but at this moment in time, and one of the issues in the presentations that our code enforcement group is making on a regular basis for short-term rentals is people aren't always aware that their residential rentals that they have out there are not always reported to the county as rentals, which would make your data set hard to find. But we out here in Surprise are cracking down on our short-term rentals. I'm sure you've heard all about the sober living homes and all that kind of good stuff. So from that standpoint, we're really trying to work through the community, one, and have them register their rental homes with the county, step one, and two, to talk about the cost of living, whether it's a rental property or a not rental property for single family. And we don't have a lot of apartments at the moment, but we have a lot platted.
Yeah.
So for us, we're in that group of people where it's approved for that. But I was just trying to figure out what we're all trying to figure out here is if that information is in the data set. So what you're telling me is probably not, because you're just looking at existing apartments, but thanks.
We know it's important and we want to get a better handle on that, and we're going to keep trying. And I've got a note right here on my other screen to get back to Lloyd about that exact question. And
my best friend Lloyd,
yeah.
It's probably because I asked him the same question. Okay. But thank you very much. I really appreciate it.
Oh, thank you.
Appreciate it. Thank you. Any other questions? Councilmember Campbell.
Thank you. I've got a couple of questions. I would like to know if we will be able to get copies of this presentation, because we need to digest all of the information that he has given us. And then is there any possibility that we can get the zip codes? He said he had 42 zip codes of housing values that had decreased, and I think he said 5 that had increased. And that's important to us because that way we can see how we are faring in the whole grand scheme of things, of if we are in the 5 or if we're in the 42%.
Thank you, Councilmember Campbell. I sent my presentation to Mimi, and so I think that they will be able to share it. I don't want to speak for them, but
it's posted online, and we'll be sending it out by email directly to all committee members right after this meeting as well.
Wonderful. Thank you, Amy.
Thank you. I'm terrible. I don't go online very often, and I rely entirely on getting the presentations via the email.
Okay. Well, then what I was going to say next probably isn't for you as much as maybe some other people, but like I said, a lot of the stuff in my presentation is also on our website at data.azmag.gov, and you can get some interactive information with that. I cannot off the top of my head remember if we have those zip codes listed, but I can provide that to me, and we can send that out to you. But you'll also be able to see it in the slides when you look at it.
Okay, thanks very much.
The zip code outlines are there.
Okay, Councilmember Duff.
Yes, I have a couple questions. First of all, and I may have missed it, do you have an estimate of how many total housing units were short for this area? I see the supply numbers, but what is our aspiration? What is our goal? Are we getting closer to closing the gap other than seeing the trend?
That's a great question. And this has been one of my bugaboos for a little while. A couple of years ago, the state housing department put out a number that is based on not anywhere near any kind of methodology we would use, but that number got legs, and you've seen, I know you've seen it. It's nobody has that answer, is the short answer. So if you ever see that number again, just please don't believe it. We've talked to the league about trying to find a way to do it, because we focus on the MAG region, and if we want to find a number for Arizona, that's not something we have easy access to. So we're working with the League of Cities to see if that's something their members are interested in. We can probably help them with some data, maybe some methodology, but we don't have that number at this time. It's a complicated question, because when the home builders and their allies were using that number from the previous administration at the housing department, they're using a single number, which is easy to say in sound bites, and it's easy to throw out there, but it doesn't take into account anything like price points, location, access to transit. And that's one of the things we struggled with. If we ever were to come up with some kind of number for that, for our region, or to help the league with the state, a single number just doesn't do you any good. What I can tell you is that that number was largely based on a report that Phoenix put out for their city, and it was they divided it into total number of units, but also number of units that are affordable or that are needed for the city, and 2/3 of their numbers were the affordable numbers. It was something like 150,000, and this was like 5 or 6 years ago, but it was something like they needed 150,000 units, they estimated, but they needed about 100,000 of those to be affordable. And so that's one of the big issues, that you can't just say we need this many units, we need this many units, this many price points, and we need subsidized units, and we need various things like that. So a very long answer to a very great question, and the answer is no, we don't have that number. I wish we did, but we would love to come up with something, but it's complicated. Yes.
I agree. And I'll just sum up with our city. We did a balanced housing analysis, and it was really interesting that at AMI, that we have plenty of housing available to the number of households who qualify. The affordable, the under like 80%, more like 50% and 30% of AMI, we have severe shortages, as well as on the upper end of executive housing. But I think on the upper end, maybe people are not choosing to spend their entire income to what they can afford.
Yeah.
I'm more concerned about the lower income, but it was because we hear from the development community so many times pushing, as build it and it'll all work out. But we're finding when we have plenty at the AMI, or up to about 180% AMI, but you get below AMI, and then that's where the shortage really is. So I think it's a kind of a wake-up call to where we need to focus our housing efforts. Thank you.
That's great information. You're from Mesa, correct? Thank you. That's great information. One of the issues when we get into price point is, we've got so many great home builders. So many of them are building higher end homes, and so if you just flood the market with that, you're going to have a lot of high end homes, and eventually people aren't going to be able to afford them. And I think, just anecdotally, it seems like the apartment builders even have a bigger issue with that, because nobody's building low end apartments, because nobody wants to do that. The construction cost may not even be that different, and it's probably part of the problem. But if everything's luxury apartments, and then everything's expensive, and so there's no easy answer, unfortunately.
Appreciate it. Any other questions out there? Seeing none. Scott, first off, I want to thank your presentation. This is awesome information. I just recently had a 4-part conversation in the city of Tempe with housing. And for everyone listening, I mean, with your staff, with the resources, with MAG, Arizona State Real Estate School. I recently had a presentation yesterday from Land Advisory on these topics. I know these are hot issues in every community, and the growth and what we're dealing with affordability and homelessness. Even seeing data on the fact that, you know, when we talk about homelessness, there's a lot or you know, sometimes about half of the people on that are homeless is because of housing affordability and just, you know, living out of their van, street car, whatever it may be, but are actually just needing, you know, just housing services. And this is such an difficult thing to do when it's basically supply and demand. And I think that kind of to the point of you have high-end housing, high-end apartments, still at the same time, that is, from what I understand, is helping the housing solution because affordability hopefully will soon come. The fact that we can't, and I think that what our communities often come across is we need affordability now. And that's the struggle, is it's a slow process to get to that point. And I think that with projections going up, I just saw yesterday, the West Valley and the Far East Valley, oh my God, the explosion that you guys are going through, the high-end demands of, you know, or I'm sorry, the forecast of even higher end jobs within that area. You talk about the Taiwanese chip manufacturing plant and all that region around that rim of the 303 down south, even further past the Santans, is intriguing. There was also information yesterday, even on water restrictions and water rights, possibly slowing down, creating more of a stall in the housing crisis, which could be something critical to think about going on. But I just want to say that I think if you guys are having the conversations with the community, just having a community outreach, use or utilize some of these presentations to talk to the residents. Utilize, you know, what we're hearing today and what we're seeing today. Utilize other resources, like I mentioned, with ASU Real Estate or even Land Advisory. These are great conversations, or internal with your staff and what they're providing. They're great conversations for our constituents in understanding the dilemma that we're in. And I think that's an opportunity to share that information. And it's great opportunity with this information for us to understand, but us to translate it to our residents. So a lot of good stuff. Amy?
Thank you, Mr. Chairman, and members of the committee. Thank you so much for that endorsement of the presentations and the data. If any of you would like this presentation for your council meetings, please do let us know. It could be a study session. It could be a regular council meeting. We would love to come out and present. Also, please do keep in mind as well that if your community is trying to develop affordable housing and you're facing community opposition to that, let us know. I'm happy to come out and present at the city council meetings as well. We've done so, and we've been able, and not because of my presentation, certainly it was definitely the hard work of the mayor and the council from the individual communities, but we want to support your hard work. And we've been able to get some really good developments across the finish line under some initially fierce opposition from the community. And that's been for affordable housing. It's been for homeless housing. So please do let us know. We're happy to assist. And, you know, sometimes just putting the data out there to help people to ground the conversation on facts can be helpful. This can be, of course, a very emotionally charged conversation. So for example, we're just presenting yesterday at the MAG Management Committee meeting and sharing data about evictions. Our eviction rate for 2023 was 14%. For the national average is only 8%. We're almost double the national rate for evictions. So we're going to see a lot more people losing their homes because they simply can't afford to maintain them anymore. And as a result, we see increasing rates of homelessness as well. And particularly when we look at the people being hardest hit, it's the lower income areas, of course, for the eviction. 79% of those evictions were in low income areas. But then when you consider the people too, so looking at the middle income workers, we're talking about the teachers and the firefighters and the police officers and the construction workers. And at entry level, they cannot afford to even rent, never mind own a home across the region. It's simply out of reach. I think on the chart that was shared yesterday, I think it was nurses and one other category of middle income workers who are able to afford housing right now in the region, and the rest, they're simply priced out of that market. So It's a critical issue. We want to support you in every way. So let us know if we can share data. Let us know if it's helpful for us to come and speak in support of your affordable housing efforts in your communities. We also do have the Affordable Housing Public Education Campaign, Home is Where It All Starts. We've shared that previously. That can hopefully help in the effort to raise community acceptance of this really important housing part of your portfolio, and keeping in mind that every community needs a diverse housing portfolio. Not every community has one currently, and it's not for lack of effort by the mayor and council. It's for a variety of different factors. And if we can be of assistance in addressing any of those factors, please do let us know. Thank you.
It's awesome information. Any other questions? Scott, thank you so much. Great presentation. A lot of good information. This is a hot item, obviously, and appreciate that. And then we also have the information passed along to everybody here, so stand tuned on that. Okay, we're going to go ahead and move on. The next item is a request for future agenda items. Are there any requests by the members for future agenda items? Anyone? Once, twice. All right, hang on to that for next meeting. Item 8, comments from the committee. Anybody that has any announcements out there? Seeing none at this point. I know we're getting lengthy here. We're going to go ahead and then adjourn. Thank you guys for being in attendance today. The next Human Service Committee Initiative, Community Initiative meeting, or committee meeting, will be on Thursday, March 14th, 10:30 a.m. No further business today. We are adjourned. Thank you guys for being here.